Israel says that a record number of trucks brought aid into Gaza yesterday, 277 to be precise. That would be triple the level every day in February. However, the UN Agency of Humanitarian Relief and Gaza's Border Crossing Authority dispute that number, saying it was really about half that. Whatever the number is, it's still a far cry from the roughly 500 aid trucks coming into Gaza each day before the war began. That has countries starting to conduct airdrops. Today, Belgium's foreign ministry said it had dispatched a cargo plane to begin. This follows on the heels of the U.S. this weekend and other countries before, Jordan, France, Egypt, and others. Obviously, every bit of aid is welcome, but to put things in perspective, the U.S. dropped 38,000 meals, and just in Rafah alone, there's 1.4 million people. The U.S. held off on making these drops for months, we're told, because they're inefficient. You can't guarantee that the aid reaches the people who really need them instead of going to Hamas. And also, it doesn't replace the amount of aid that truck convoys can bring in. Aid agencies say that to reach the level that it was at before, they would need a ceasefire. The WHO's director shared information from a mission to visit 2 hospitals in Gaza. This was the first time the WHO got in since October. It was shortages of fuels, electricity outages. It was shortage of medical supplies, shortage of food, children starting to starve to death, hospital buildings destroyed, and he called for a ceasefire. Gaza's health ministry also shared figures revealing the scope of the damage to the healthcare system since the start of the war. 85 hospitals and medical centers out of service, 126 ambulances targeted, now inoperative, 155 health facilities destroyed, 269 healthcare professionals detained, and 364 of them killed. In Rafah on Saturday, we saw an airstrike on a tent area outside of a hospital that also killed a paramedic and a nurse. And the CEO of humanitarian group Project Hope said a nurse at one of its clinics had his family home bombed last night, killing him and 7 family members, including a pregnant woman and a child. Now, Israel says it does its best to avoid civilian harm, and that any eventual deaths are the result of Hamas positioning its fighters, its tunnels, and its rocket launchers in dense residential areas. Be that as it may, it's obvious that the collateral damage to both the healthcare system and the people who work at these facilities has been significant. David Biller with the Associated Press for CGTN in Jerusalem.